particular case that comes to mind is a young man in his 30s, and he had undergone bariatric surgery, which is, if for the people who don't know, that's a weight loss type of surgery, and that can be either a gastric sleeve or it can be sort of switching of the intestines around a little bit. Um, anyway, this person had lost about 100 pounds. So even though he was young, 100 pounds is a lot of weight to lose. So there was a pretty significant amount of laxity of kind of the lower abdomen and the trunk area, and also of the chest. And so he presented, and he wanted to have some correction of those things. And so we ended up doing really several procedures on him, to include a circumferential abdominoplasty, which is just as it sounds, it's an abdominoplasty. It doesn't just stop here, but it goes all the way around, so you get a lift of the entire trunk region.
Throughout the course of my life, I had struggled up and down with weight gain and loss. So I had a lot of challenges with gaining weight and losing weight, and I wanted to get rid of some excess skin and look at some liposuction in areas that were kind of hard to work on while at the gym. And so when I came to El Paso, I looked at a lot of different doctors in the area, and I was just more intrigued with Dr. Jabor's work as I continued doing a lot of research into patients that he sees, the work that he's done, and that's primarily what got me interested in visiting his website and reviewing a lot of the patient testimonies, and just doing some background information on that. And when I contacted his office, things just took off from there, and that's where it began.
He had also some liposuction done, and then he also had correction of the chest and the laxity of skin of the chest, which included liposuction and also taking up some of the skin. And he did, really, really well afterwards. And he went on to actually to kind of get even in better shape afterwards. So he was so kind of inspired by what he saw, and what the improvements that he had, from the surgery, that he went on to go and work out and get much more toned and much more muscle mass. And then now when like I come back, or when he comes back to see me, and I look at him like, man, you look fantastic. And and I know I did part of it, but I know that he also did a large part of it. But in 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 at least a large degree inspired by, I think, what he saw, with the extra skin gone, and now feeling more like what he thinks he should feel like. One thing that I've heard a lot from people who've had bariatric surgery and have lost a lot of weight, or even if they've just lost a lot of weight on their own, is that even though they've lost a lot of weight, they still don't feel thin. They just still don't feel normal, because they have all that extra skin that still persists. So until at least in their mind, until that is removed, until that is corrected, that's kind of like the complete transformation. And so that's where the plastic surgeon comes in. It's either with diet and exercise, or with diet and exercise and surgery, the weight loss can happen. But most of those people don't feel complete until the body has been corrected, the morphology and the anatomy has been corrected back to what it was, before all of that happened.
At first I did feel a little awkward, but as you start talking to the staff, they really did a good job of making me feel comfortable, and getting that information from them. I first, of course, got a quote, and then I actually scheduled the date with Dr. Jabor, and had my first procedure done. I had the abdominoplasty 360 done with liposuction, and that in itself, it was an experience that the outcome was positive, and I say that because it was my first surgery ever in my entire life. I didn't know what to expect. I came in thinking I was going to be in probably excruciating pain, at the end of it and during the recovery. But that wasn't my experience. It was very, very comfortable. I had, of course, the garments that they'd given me. The staff here, especially working with Selena, she was great in checking in on me. And of course, working with Helen at the beginning with getting the information for all of my paperwork and things organized and filed. That really was a big help in helping me plan it. But during the course of my recovery, it took me probably around 3 months to really feel like myself again. And I say that because too, it was very different. It was a change for me, not having to, well, one, walking around with all the garments, that was one thing. But two, of course, the drains for a period of time, and then when the drains came out, taking care of those wound areas and making sure that, of course, everything was maintained well. My experience overall was really, really positive and good with this office, and I think that's, well, and I know that's a big contributing factor to why I came back for some more work and have other things that I'd like to potentially work. Well, one more thing I'd like to potentially work on and schedule with this office.